Joe and I have depression.
Hi, I'm Harriet and I've had experiences of anxiety and depression.
Hi, I'm Nick and my diagnosis is emotionally unstable personality disorder.
My name's Katie and I got diagnosed with depression and an eating disorder.
Hi, I'm Isla and I suffer from depression.
Hi, my name's Liv and I've been suffering from anorexia and depression for the last 10 years.
Hello, my name is Aham. I suffer from panic disorder, generalized anxiety, depersonalization and derealization disorder, in addition to obsessive compulsive disorder. That's the one.
For me, it all really came to a head after I had a head injury. I knocked my head jumping about, celebrating, doing well in my exams in America. And as a product of that, I couldn't sleep too well and I got quite depressed and migraines. And I thought that was all sorted out, but when I came back to the UK, I suddenly started to find, when I'd gone back to university at Exeter, where I used to be, I suddenly started feeling very, very anxious, which was entirely new to me. I'd never felt anything like that before. And I eventually reached out to doctors, and over a longer period of time, they have settled with doctors, psychiatrists, and the whole rigmarole of lovely people with nice names, come to a diagnosis of emotionally unstable personality disorder.
In 2009 I went to the student counselling service, which was really, really good, and on their recommendation I went to see my GP, and then I did all the forms, and that's when I got diagnosed with an eating disorder and depression.
6 months ago, those severe symptoms started to accompany this bundle of disorders. Then I visited another medical practitioner who told me that I'm suffering from 3 more serious disorders that are obsessive compulsive disorder, derealization and depersonalization. That was when I first realized that I had them.
Obsessing over my appearance and my health and stuff.
Mood swings, pretty rapid ones. The best way of describing what it's like is that I remember one incident when I was at home and it was the middle of the night, I wasn't sleeping too well, and I'd gone downstairs to the fridge to get myself a snack, open the fridge, I see nice food because mummy's been shopping, and I'm ecstatically happy. I'm as happy as if I've just got my GCSE results and I know I've done well and I can go to a decent sixth form. And then 3 seconds later, I realise that this is an abnormal reaction and my mood crashes. I'm struggling not to cry. I'm feeling like life is awful. That's a very bad day, but those sort of shifts, having an abnormal strength of response or the wrong response or no response.
Sometimes I'd wake up in the middle of the night because of a panic attack, a night terror, and I'd head to the bathroom and I'd look at myself in the mirror and I wouldn't realise it is me. That is depersonalization. Losing touch with yourself.
And I just kind of hide in my room and avoid doing things.
It was quite a big step to have to start looking after yourself in a way. So for me it was quite easy to start skipping meals, to start doing more exercise, and gradually it became out of control.
I used to stick to a diet rigorously, and if I would ever stray from it, then I'd always feel like horrible about it.
Turned to binging and then in the end kind of making myself sick just because I just felt really bad and trying to I just lost control basically.
Racing heart all the time, inability to breathe, sweating, what else? Flu-like symptoms all the time being tired, fears of going mad and insane.
Finding it very hard to cope basically with any kind of emotional situation, and just not sleeping, not eating, just on and off really, like my appetite, sometimes I just not even hungry for like 3-4 days.
If you think about the number of times you go out and have meals with friends or you go and have drinks, both meals and drinks have calories in them. It stops you going out. Additionally, with no energy, which is a consequence, I'm just absolutely exhausted, or was absolutely exhausted most of the time. So it got to sort of 5 or 6 p.m. and actually all I wanted to do was go to bed rather than go out and have fun.
If you're quite emotional all the time and stuff, people don't really want to spend time with you. Just because it's a drain on them as well.
And in terms of academia, It is difficult, especially with the lack of energy. It does. There are times when I'm in bed and I wake and the alarm goes off and I just go, this isn't going to happen. I really can't do this today. And so there are some days where I do miss, but I do catch up eventually.
There were good times and there were bad times. When I find there's a sweet spot where I'm just the right amount of, not quite manic, but I have lots of energy. My mind's working really fast and I can plough that. I can be very social and I can plough that into work. But the flip side of that is there was a really dodgy patch in the last term when I just couldn't think clearly. I was trying to read articles for my course. I do politics. I was trying to read an article which I'd have normally loved, and I couldn't hold the argument from the beginning to the end.
So I avoid going to many lectures and seminars because I'm afraid that when I go there, I'd get a panic attack and nobody's going to be able to help me. Because imagine getting a panic attack in the middle of the lecture with 300 students around you.
Counselling is good, but drugs and counselling is even better. If it's a physical kind of, if it's physical depression.
A diagnosis did help. It gives you a label, and while that can be really unhelpful in some ways, it means that it's less unknown.
Actually, the thing that helped me most was dropping out.
What also really helped me was finding God.
I just put myself in a completely different situation, took myself away from all of the things that were hurting me, and I was suddenly happy.
One of the things that really helps me is having things to look forward to, like just planning little things, like I want to get my nails done because they're grim at the moment.
And I returned to do, I started a new master's here, and I've completed that, and now I'm on a PhD here. And I think that having that year away helped me learn after having of that intense pain, and then finding a situation in which I was much happier actually was most of my therapy, because by being happy I could manage to start understanding all of the things that I couldn't absorb when I was in a mess.
Getting referred by the doctor and having the CBT kind of one-to-one therapy, which really broke the cycle. But I've still struggled since then, but I've kind of, like they said, like it teaches you to be your own therapist, so when I slip up it's not the end of the world like it used to be. It doesn't mean anything, it's just, it all got a bit overwhelming.
In crisis, medication helps me, and I found a medication that works, and so when I need it I take it, and that gets me through until a point when I can use strategies that I've been taught through counselling.
Yeah. I think what worked in the end was just realising that friends were there and friends actually wanted things to wanted to help and make a difference, and certainly the number of text messages and phone calls I made during those 2 months of sort of trying to get back on track last year were the most valuable.
I feel like the support services I get from the university, like in terms of the counsellor and the doctor, are kind of the best thing for me.
It does help me understand people's problems a lot more than I would have originally done.
I've learnt that it's okay to have limits.
And I've had a few people come to me over the years saying, I'm a little bit worried about this. Do you think I should see someone about that? And I like to think that I've been able to help them a little bit, just point them in the right direction. Just to try and make what isn't a very nice experience that little bit less awful.
If I'd been reliant on the NHS, I'd have had to waited 6 months for just an assessment, let alone actually any kind of therapy. So that's definitely made me keen to get involved in kind of campaigning or mental health awareness and an availability of care for people with mental health problems.
And I'll always be supportive of if anyone else feels down for no reason or down for what they think is a stupid reason, because it doesn't change how you feel.
I've definitely learned that there's no point trying to be someone else that you're not, and that just being you leads to a much nicer or much happier existence.
Since I got diagnosed, it's like things got a bit better. Like meeting new people and stuff, and I don't know whether that's because I've had a bit of an attitude change or whether it's just luck. I actually think that everyone could do with a little bit of counselling. Just that safe space to just go and cry or scream or whatever you want to do without being judged.
Like, make sure that people know, and if someone isn't giving you a positive response, find someone else.
It would be helpful if people just said to you, like, you know, I'm here if you want to talk, but didn't bring it up all the time.
Don't give them the cold shoulder, because someday you might be suffering from such a disorder, and you might need to talk to somebody about it.
But yeah, just kind of be there, be willing to listen, and occasionally be prepared to drag them out when they say, no, I don't want to go out, no one wants to see me. It's like, no, we do, come on, come out, go out of the house.
Yeah, advise your friends to go to counselling.
And remember that you're not responsible for fixing your friend.
How are you is a completely fine question to ask someone with a mental health diagnosis. It's not, you might get more of an answer than you're expecting, but it's a good question. Hi, I'm Nick. Hi, everybody. Please don't use that one. We'll have an outtakes soon.
Don't take me too seriously, because I'm not a medical practitioner and I can't give you medical advice. But, and the big but here, we'll have to edit this and people will be making fun of it. Big but.
Is this when the upbeat music comes in?
Yeah, this is right.
Hi, I'm Nick.
No, that's fine.
It's the way you're laughing at the back. Going.
Sorry.
It's a little fun.
Can I swear?
I shall try and make it a good one. Hi, I'm Harriet, and I've had...
I forgot my name.
Katie.
I'm Katie, and hi, I'm Katie.
It's fine, it's fine.
We can cut it out, it doesn't matter.
What's the first question?
Sorry, it's good.
I don't like saying my own name.
Me too.
No. I don't feel like I say it right.
Don't give them the dead hand. Is it the dead hand?
The what?
The dead something, like when you tell someone to just go away.
Cold shoulder.
Oh, cold shoulder. Yeah.